Well, many people don't know that liver diseases are not always related to alcoholism. In fact, since 1988, a little-known autoimmune disease is actually the second overall leading cause of liver transplants in women in the U.S. who are typically diagnosed in the prime of their lives. To learn more about this disease known as PBC, I am joined now by Dr. Kowdley and PBC patient Allie. Thank you for joining me today.
Thank you.
Now, first, doctor, what exactly is this condition that's causing more liver transplants than alcoholism in women?
PBC stands for primary biliary cholangitis. And what that term means is that this is a disorder that is not known, the cause, except we know that it's an autoimmune disorder. And in patients who have a genetic predisposition, the immune system attacks the bile ducts in the liver, and the bile ducts get inflamed and get scarred, and over time may lead to progressive liver damage. So this process may take years. Patients who develop this can come from all walks of life. It does predominantly affect women. 95% are women in the prime of their lives, between 35 to 60 years of age, and it has nothing whatsoever to do with alcohol intake. So it's important that patients be aware of this condition, especially if they have an autoimmune condition such as thyroid disease or a family history of autoimmune disease, or if they have nonspecific symptoms such as itching or fatigue, which may be early warning signs of PBC, although many patients have no symptoms whatsoever. So early diagnosis is the key to confirm the diagnosis and initiate treatment to stop the progression of this condition.
Now, you talked about diagnosis. How exactly is PBC diagnosed, and is there anything that women can do in regards to their own personal health and lifestyle changes to prevent PBC?
Unfortunately not. We know that there is a population of patients that is predisposed based on their genetic profile, which of course is something that patients cannot change. And there may be one or more environmental triggers that then causes the disease to express itself. And we don't have any clear cause or risk factors that is within the patient's control. There were some early studies that suggest maybe exposure to certain chemicals, such as hairspray, may trigger PBC, but we have patients who have not had any of those exposures. So really, anyone is at risk for PBC. There's no simple test to identify who may get it, but the good news is that diagnosis does not require any invasive procedures or obscure tests. A screening panel of blood tests to examine the liver chemistries, in particular to examine the alkaline phosphatase or ALP, and a confirmatory test called an AMA test, which is a blood test, an antibody test, can confirm the diagnosis in 95% of patients. So it's important to recognize that it's easy to screen for, and the confirmation tests are non-invasive.
That is definitely reassuring to know. Now, Allie, you're currently living with PBC. Can you explain to us how you were diagnosed and the lifestyle challenges that you faced since then?
I was diagnosed when my husband and I decided that we should go get our yearly physicals, and our physician did the battery of tests that he was supposed to do, the blood work. And 2 weeks later, he called me and said, we need to have a very frank discussion about how much alcohol you drink. And I said to him that I didn't drink alcohol very often, and I was confused. And he said, well, that made two of us, because he was confused as my blood work showed that I was an alcoholic. And since I didn't drink, he thought that we should repeat the blood work, do some imaging, some ultrasounds, and then do some blood work to rule out that I would have a very rare disease, PBC, PSC. And he called me back 2 weeks later and said, you do in fact have PBC. The good news is that although it's rare, you can start taking medication for it, and it will slow down the progression of the disease. It's a very slowly progressing disease, and you need to take this for the rest of your life. So once I got over the initial shock of all of this, I learned how to take my medication regularly, because that was sort of a new lifestyle change, trying to fit that into my routine, being busy mom, wife, teacher. So the other big thing is that being a mom, particularly a woman, we tend to take care of everybody else except ourselves, even if you have a chronic illness. So the takeaway is that really sometimes you need to be selfish for a second and not be super mom, and let everybody else know what you need at that moment. Maybe you need some downtime. Maybe, the big dinner you were going to go out and have, you're not going to go out and have. You're just going to stay at home and relax. So that's the big thing. Just take care of yourself. Be your best own advocate.
Yes, absolutely. And thank you for sharing your story. Now, doctor, what should women be asking their physicians to make sure that their liver is healthy? And also, what should they be asking them to check for PBC?
So patients should ask their physicians if their liver tests have been checked recently. And they should want to know their alkaline phosphatase or ALP level, and also their liver enzyme levels, the AST and ALT level. If those are completely normal, that would be reassuring, and PBC can be ruled out. For those patients who do have an elevated alkaline phosphatase level, review with their physicians of all of the medications they may be on, because medications can sometimes lead to those levels being elevated. Review with the physician all the supplements that you might be taking, because that could lead to an elevation of your liver enzymes and ALP level. And then ask to make sure that an anti-mitochondrial antibody test or AMA test has been done, because the combination of liver chemistry tests and AMA can confirm the diagnosis in the majority of patients. And that would be the first step to screening and confirming the diagnosis.
Thank you for that. And now, Allie, you shared earlier some of the takeaways that you would like women to learn. Can both of you share with us what are some of the most important factors to remember for women when it comes to this condition?
Well, for one, you really do need to make sure you get that physical scheduled, and that you take care of yourself, because if you don't take care of yourself, you aren't going to be able to take care of your family and those that you love around you, or even be able to function at work very well. And if you need more information about PBC, you should go to livingwithpbc.com. You'll be able to read about patient profiles and resources that you could hook up with.
Thank you so much for that. And again, for more information on PBC, visit livingwithpbc.com. Thank you so much for joining me today, you two. It's been a pleasure.
Thank you.